All right, let's talk discs and types of disc injury and types of disc problem. I've been treating discs for over 15 years. They've been a central focus of mine for at least a decade. And I have heard so many different terms for trying to describe disc injuries or disc problems. It's laughable, really. There are three accepted and proper terms that get used for the most part in disc injury. And I get this from the North American Spine Society. There's a combined task force with radiology groups, with spine societies, with universities. They published a paper in 2001. They updated it in 2014 to standardize the nomenclature or the words we use to describe discs. You've got disc degeneration, which at its heart is a dehydration and collapsing of the disc. So a healthy disc has a middle portion that has a lot of water in it. It's very well hydrated. It's like a gel. And if that dehydrates, where there is no water or gel in the middle, that's disc degeneration. And then it becomes a thin disc. There we go, a thin, small disc. And that's a degenerative disc, and it gets worse over time. Degenerative discs are often associated or have accompanying them bulging discs, where it bulges out from the side. And that can happen, but bulges can happen in the absence of disc degeneration as well. A bulge is where the middle gel portion is pushing out. It hasn't ruptured through, all right, or torn through the annulus. It's still contained within the annulus and bulging out over a fairly wide area. Technically, it's 25% of the circumference. Most of you don't care about the technicalities. It just means it's a wider, more shallow bulging of that middle jelly type material. Then there's disc herniation. Disc herniations tend to be the most severe. Not always, but in general, disc herniations tend to be the most severe. Not always, but generally speaking, they're associated with trauma. And disc herniations are where the middle jelly is actually broken through, torn through the outside of the disc, and now you got the jelly outside of the donut, so to speak. All right? All three of these disc problems can be treated conservatively in an office like mine that's set up to deal with disc rehab. I've had tremendous success keeping the overwhelming majority of people away from the knife, not having to have surgery, and being able to live, functional, pain-free life, even in the presence of some of these disc injuries. And often we're able to rehydrate a disc so that it's no longer dehydrated, or we're able to retract the bulge or the herniated material so we take pressure off of nerves. So if you do the right type of rehab and the right type of treatment, you can retract that herniated or bulged material. You can draw fluid into the disc, pumping it up like a water balloon so it's not as dehydrated, or sometimes, if you catch it early enough, not even dehydrated at all anymore. So if you're having any of these problems, or if you have a different problem in your head, like you say you have a slip disc, you don't have one of those three, you have one of those three, you've just been given an improper term, I'd love to talk with you and see if we can help.